Welcome everyone. Good morning, good day, and good evening, depending upon the time of day and your part of the world. Thank you for joining us live, and to those listening to tape presentation afterwards, welcome. I'd like to warmly welcome our expert panelists, which we'll be introducing to you very shortly. But before we begin this important webinar, it's also important to state that we stand in solidarity with our colleagues and friends in the Ukraine, and we will do all we can at FIP to provide real and emotional support. The FIP webinar today is entitled Enabling Multi-Professional Vaccine Prescribing and Administration for Improved Uptake Rates. And this is a very important area of pharmacy practice and patient care, and is an area of my own interest and one I'm extremely passionate about. The webinar is focused on the European region today. My name is Ron Goose. I'm a pharmacist, a former regulator, and assistant professor coming to you live from Canada. I'm also the past chair of the Canadian Patient Safety Institute and past co-chair of Healthcare Excellence Canada. I'm currently a Canadian consultant with the DOT Pharmacy program of the United States National Association Boards of Pharmacy, and for the past 16 months, chair of FIP's Regulators Forum. In today's webinar, we will be having a panel discussion on vaccine prescribing and administration. We have assembled a panel consisting of healthcare professionals, public representatives, and policy leaders, some of which are outside the profession of pharmacy. And they will present their thoughts and participate in discussion of this timely issue. This is not just about the recent or still current pandemic, but really for a broader picture of vaccinations. In many countries, vaccinations coverage rates are suboptimal. The services are largely focused on childhood vaccinations. Critical goals to expand vaccination pathways, including having more and more easily accessible vaccination points and more professionals who can deliver vaccinations to a greater number of people and increase access to those living in remote and underserviced areas. However, equally important is the access to evidence-based advice and information on vaccines and vaccinations. This event will discuss the drivers and the barriers of interprofessional understanding, cooperation, and vaccination task sharing in areas within the European region. Additional information will also be provided regarding the regulatory authority and oversight granted to different healthcare professionals to prescribe and/or administer vaccines within this region. We have a lot to talk about over the next 90 minutes, and I'm only one of the moderators in the webinar today. Without further delay, I will introduce to you my co-moderator, Lars-Åke Söderlund. He has extensive experience of working together with the Swedish healthcare sector in improving health and creating the sustainable healthcare system. He has been vice president of the Swedish Pharmaceutical Society and has a number of executive positions with Uptake, recently as head of national customers and new business. He was president for 10 years for the Swedish national project Check My Medicines, which significantly improved outcomes for the elderly in Sweden by reducing the amount of inappropriate medications and improving health literacy. He's co-chair of FIP's Congress Program Committee, as well as co-chair for the FIP Technology Forum. He is immediate past president for the Community Pharmacy section within FIP, and now serves as vice president of FIP. He is an FIP fellow and has received several other professional awards. He is a frequent speaker in Sweden, internationally regarding the future of healthcare and pharmacy. In a few short minutes, I will welcome Lars to take over the audio and introduce our excellent panel for today's event. But now I have some pertinent information to bring to your attention. Please note that this event will be recorded and live streamed on FIP YouTube and will be available at the FIP website through events.fip.org. And certificates of attendance will be issued by FIP to all those in attendance during the live program, but also for those who view the video at a later date. To all those listening live, please feel free to send your questions to the Q&A box and Lars and I will do our very best to manage and get answers to all those questions you place in the Q&A box. You're most welcome to provide feedback on the webinar using webinars@fip.org. And if you're not currently a member of FIP, please take a moment after the webinar to join. The memberships have many benefits, including an invaluable resource, networking, timely events, and of course, webinars. I can tell you from my experience, an FIP membership has increased my knowledge and has proven very useful in performance of my duties. And of course, FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you're a pharmacist or a pharmaceutical scientist and you would like to become a member, please join through the FIP website at www.fip.org. And this is the amazing panel. We will work with you for the next 9 minutes. And I want to sincerely thank each and every one of them for taking the time to join us today. Lars will be doing the introductions right after I describe the program for today and remind everyone of the learning objectives. Well, the program's relatively simple and straightforward. We will bring you some background information, and then we'll introduce the panel members to you and get right into the roundtable discussion. We will have time at the end of the presentations to answer your questions that you've placed in the Q&A box, and I'll remind you to do that. And then we'll have some closing remarks before we finish the day and bid you farewell and best regards. The learning objectives for today are to first identify drivers and barriers related to the regulatory landscape of vaccination of the region, learn about examples of best practices in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccination, and exploring the plans for switching from a pandemic to an endemic response in the region, including the role of pharmacists in vaccination and in patient care and treatment. GSK supports this series of regional events through unrestricted funds. It is very important to note that FIP has independently developed the program, selected and invited speakers, and developed the questionnaire. Now I will welcome Lars, my co-moderator, over to you, my friend, and please turn on your microphone and take over. Thank you very much.
Thank you so very much. Good morning, good afternoon, and good evening, everyone who is zooming in to participate in this very important event. And thank you so very much, Ron, for the kind introduction. It is indeed a great honor and pleasure to co-moderate this event with you today. And as you mentioned, we have a group of highly experienced panelists with us today, a group of fabulous and knowledgeable pharmacy leaders, and I will shortly introduce them to all of you. I would like to mention the life course approach to immunization. A life course approach to immunization offers a valuable opportunity to improve health, support health system sustainability, and promote economic prosperity. And policies that support immunization across the life course, rather than restricting it to childhood, have the potential to benefit individual and population health, promote healthy aging, support the long-term sustainability of health systems through reduced healthcare costs, lead to a wider economic benefit by promoting workforce productivity, and support equity and universal access to primary care by providing a platform around which these services can be provided, and also reduce the spread of antimicrobial resistance. The International Pharmaceutical Federation, FIP, strongly believes that pharmacists should be involved in vaccination strategies in a multitude of roles everywhere around the world, and has given high priority to this area for over a decade. And in recent years, the number of countries that have introduced vaccination by pharmacists or at the community pharmacy has increased, which is very positive. However, barriers and opposition to this expansion of pharmacist scope of practice remain in many countries, and FIP wants to inspire countries to move forward and individuals to act. As vaccination is one of the most, I would say, successful, safe, and cost-effective health interventions of all time, improving vaccination coverage is a global imperative, and pharmacists must join these efforts. So the pharmacist's unique contribution is actually access, proximity, extended hours, especially when others are closed, ability to identify high-risk patients easily based upon their medications, public's trust and enthusiastic acceptance, and of course, practice guided by nationally adopted guidelines, as well as support completion of multi-dose vaccines. And we also have a very knowledgeable vaccine resource within pharmacy, and we have the appropriate education and training, and we are able to handle also storage issues. Next slide, please. So allowing pharmacy vaccination improves efficiency and increases vaccination rates. Pharmacies provide services much closer to people's homes or offices, and patients obtain vaccines at the more convenient hours, such as lunchtime, evenings, or weekends, whenever it's convenient for them. And pharmacies frequently administer vaccines at lower cost than doctors' offices or medical clinics. And we can improve access to healthcare in rural and medically underserved areas. Next slide, please. Here we can see some examples linked to today's theme, enabling multiprofessional vaccine prescribing and administration for improved uptake rates in Europe. And as you can see, there are a number of countries where pharmacists vaccinate in different perspectives. So by that, I think it's now time to move forward and as such introduce you to all our fantastic panelists today. It's a great honor and pleasure to introduce them to all of you. Let me introduce Inga Lili. Inga Lili is the president of the Pharmaceutical Society of Iceland. She is also the business unit lead for Pfizer in Iceland. Prior to her current role, she worked as a project manager for pharmaceutical companies in Japan, Taiwan, and Iceland. We have Jean-Pierre Michel, a doctor who represents the European Union of Geriatric Medicine Society and the European Interprofessional Council on Aging. Dr. Michel is Emeritus Professor of Medicine and former head of the Academic Geriatric Department at Geneva Hospitals and Medical University. And he is also an honorary professor of medicine at Limoges University in France and Beijing University Hospital in China. After several years of working as ambassador of the International Association of Gerontology and Geriatrics World for Asia and Middle East, he is now acting as director of the association's Federation of Geriatric Education. We also welcome Emma Paulino, president of the National Association of Pharmacists and member of the National Vaccine Advisory Committee in Portugal. Emma completed a degree in pharmaceutical sciences from the Faculty of Pharmacy of the University of Lisbon in 2001, and having also completed a postgraduate degree in community pharmacy in 2003. Emma is a practicing pharmacist at her own community pharmacy in Portugal, and she is also president of the National Association of Pharmacists and general manager of EasyFi, a company that engages community pharmacists in the implementation of patient support programs. She has also been the professional secretary of FIP for several years, and thus a member of its executive committee and the bureau. Next panelist is Mariano Botta from Italy. Mariano Botta is a public affairs professional and journalist, and is the director of Active Citizenship Network in Italy, where he is responsible for the European affairs. He is passionate about healthcare and consumer issues, and has more than 20 years of experience in the field of advocacy, stakeholder engagement, projects within the European Union, communication, and civic information. And since 2013, he has been actively involved in advocacy activities at European institutions. We also welcome Michel Bieliniak, Vice President of the Polish Pharmaceutical Chamber. A pharmacist by profession, Mr. Bieliniak graduated from the Pharmaceutical Faculty of Warsaw Medical University in Poland, and currently he is the Vice President of the Polish Pharmaceutical Chamber and has over 15 years of professional experience in the pharmaceutical market. He has a strong managerial experience related to the distribution, reimbursement, registration of medical products, and clinical trials, where he gained both, which he gained both while working in pharmacies as well as in domestic wholesalers and pharmaceutical companies. We also welcome Mr. Alain Delgout, national board member of the French Chamber of Pharmacists. Alain Delgout has been a practicing community pharmacist in Nevers, France since 1991, and he was first elected within the French Chamber of Pharmacists in 2003 and became chair of the Burgundy Council of Pharmacy Owners in 2007. Currently a member of the National Council of the French Chamber of Pharmacists, and in 2021 actually he held the position of president of the PGEU within Europe. And last but not least, it's an honor and pleasure to welcome Jean de Bellier, who is replacing Mr. Roberto Tobbia from Italy today. Jean de Bellier is a Belgian pharmacist working as the professional affairs advisor at the Pharmaceutical Group of the European Union, PGEU, the European Association representing community pharmacies in 32 European countries. And in his role, Jean is responsible for the PGEU activities concerning professional related issues and liaising with the PGEU members and stakeholders on these topics. And besides his job in PGEU, John is also continues to practice regularly in a community pharmacy. So thank you all for joining us today in this event. So I now think it's time to ask our distinguished panelists some questions linked to the topic of today's event, enabling multi-professional vaccine prescribing and administration for improved uptake rates. I will first direct myself to Michal Byliniak, and actually I will ask you two questions. Is there a need to improve vaccination coverage rates across all ages in your country or region? And who are actually the main providers and locations of vaccination services in your country or region?
Thank you for this question, and thank you, FIP, for the invitation. Good afternoon. I'm more than happy to share our experiences and information about what is going on in Poland in regards of vaccination. Unfortunately, Poland is one of the countries which rates of vaccination in some parts is suboptimal, and for sure we need to improve it. For example, depending on the age or risk group, we are around or below 10% of the vaccination rate for flu vaccinations. The COVID vaccinations shown that we are absolutely below the goal and the level of the vaccination in Europe, because we are just around 50%. Additionally, we've got some examples where situation which looks as established, like for example, measles vaccinations started to change because, for example, because of active anti-vaccination moves, which were provided to the first cases of the measles outbreak in Poland, which was connected, for example, with growing number of workers from Ukraine, where the vaccinations are, some parts of our vaccinations, for example, measles, are not obligatory. In Poland, measles vaccinations are obligatory. Current situation, the aggression of Russia will providing for sure to the huge challenge in that field, and for sure we already see a number of refugees from Ukraine, and for sure for next months we will have a huge challenge in the field of the vaccination, because beside of rates of vaccination of Polish people, we will have to take care about the Ukrainians, which will for sure provide to the huge challenges for our system and all healthcare professionals. In regards to the second question, before COVID outbreak, the standard healthcare professional who provided vaccinations were, of course, doctors and nurses, and doctors were responsible for the qualification and vaccinations, and nurses for the vaccinations. And during the COVID situation has changed because of challenges which occurs, and the number of the different healthcare professionals, including pharmacists get the right to qualify and vaccinate. For example, for today, we are able to provide COVID vaccinations in pharmacies, but also on that basis, we reach the right to provide flu vaccinations. And now we are at the moment when our authorities are maybe not very wide, but in our discussions is informing us that the plan is to provide all vaccinations for adults by the pharmacists. So situation is changing, and for sure after the pandemic we will not be in the position which was for example 2 years ago, and absolutely the thinking about the healthcare professionals who may be responsible for the vaccination in Poland absolutely has changed, and the openness for spreading these rights is absolutely now obvious for everyone who is just describing the system. Thank you.
Thank you so very much, Michel. From your first comments, I perceive that there is a huge need for advocacy, information, public campaigns, many challenges to be solved for society as a whole, and of course where pharmacy and pharmacists can play a very crucial role. Thank you. Alain, what is your opinion? How is the situation in France when it comes to need to improve vaccination coverage rates across all ages, and what are the main, or who are the main providers and locations of vaccination services in France?
Yeah, thank you. First of all, thank you for your kind invitation, of course, and good afternoon, everybody. It's a real pleasure to be with you today. Real pleasure. So for your first question, yes, of course, and especially in disadvantaged population. And why? Because we have not enough GPs in France. In particular, there are not enough in countryside, for example, or in difficult districts. And in my case, I work in my pharmacy, and I'm in this kind of district. And I haven't any GPs around my pharmacy. So to have access to GPs is very difficult for this kind of population. But there is an exception, perhaps for the young children. Young children from birth to around 12 years old are well vaccinated. And why? Because there is medical consultation. The medical consultation are free for the specific people in a specific medical office. So for children, it's okay. We have a good rate of vaccination, but for young people and adults, it's not the case. If I can give you, for example, two examples, the flu vaccination, first of one. So the flu vaccination in 2017 and 2018, only 45% of the population was vaccinated against the flu vaccination. And I remember the vaccination coverage rate, it's 75% was recommended by the World Health Organization. So we are very, very low. And pharmacists can begin to vaccinate. And the last year in 2020, 2021, the rate is more than 55%. So we win 10% of populations. And who is very important, it's population over 75 years old who are never been vaccinated against flu vaccination. And we vaccinated each year more than 170,000 people, more than 75 years old. Second example, for if you want, it's about, of course, COVID-19 vaccination. The goal of our French government is to achieve collective immunity and to vaccinate as many people as possible. Today, when we see the data, almost 93% of the French population over 18 years old are fully vaccinated against COVID-19. It represents about more than 50 million people in France. So to reach this rate, the French government recently decided to allow community pharmacists another skilled professional, of course, to vaccinate, of course, but now to vaccinate young people over 5 years old, because from the young, from 5 to 11 years old, only 2% of people are vaccinated. So to increase the rate of vaccination, now French authorities allowed pharmacists, for example, to vaccinate young children. I have no data to give to you today because it's just the beginning. It's since 2 or 3 weeks. So I hope I can, in 1 year, give you more information about this. Thank you.
Thank you so very much. I think you showed very clearly how actually pharmacy and community pharmacies can improve access to vaccinations. And that is very important. And as you also mentioned, the fantastic high number of COVID-19 vaccinations, really impressive. Well, Emma, in Portugal, I think you can say that you have had quite an interesting history of pharmacists as vaccinators. What is there actually an opposition from other healthcare professionals to the expansion of vaccine providers to include pharmacists? And what is the rationale for that opposition, if it exists, and how can it be addressed? And who supports or could support pharmacy-based vaccinations in your country?
Thank you very much, Lars-Åke, for the questions, and thank you so much for the invitation to participate in this panel discussion, Ron and Lars. It's really a pleasure to be here. So as for your first question, it is good to note that in Portugal, we have been allowed to administer vaccines in pharmacies since 2008. And that was really, it was some time ago. And at that time, there weren't many examples in Europe. I think that we were actually the first ones implementing pharmacist-based vaccination in community pharmacies in Europe. So we actually went to the United States to get some feedback from states where this was already happening, and we brought that experience for the education of pharmacists at that time. But of course, because it was a new service, at least in terms of, in Portugal and even in Europe, we faced opposition from those that were mostly in charge of vaccinating in Portugal at that time, which were the nurses. And in fact, we are now still on a process, and please bear in mind that in Portugal, courts do have very long processes, especially when they are not, of course, urgent. So we still have a process in the court. With the Nurses Association, the Nurses Regulatory Organization against community pharmacists vaccination, which we are dealing with at the moment. So we faced opposition from the nurses, but in that same year, in 2008, when we launched the flu campaign service, there was a lot of support from the population and a lot of support from other healthcare practitioners, namely physicians. And we also had the support of the regulatory authorities, who then issued also regulation for community pharmacist-based vaccination. In a way, by regulating this activity, they were also supporting this activity to take place in community pharmacies and to be led by community pharmacists. So we did face opposition. We are still facing opposition by nurses. But that hasn't had a big impact because, and this relates to the second part, or the second question that you asked about who is supporting pharmacy-based vaccinations in our country, and the population is supporting, because they are going to community pharmacies, they are asking for the service, they are very satisfied with the service. So we conducted various satisfaction surveys over time. We ensured that pharmacists were well trained. We assured that we were ready for any anaphylactic reactions or any adverse drug related events. And we collect a lot of data of the opportunity to have community pharmacies participating in the efforts to increase coverage by the population. So with that data, we have, which we have presented publicly, we have, of course, gathered a lot of support from different entities and from the population also in general for that service to be provided in community pharmacies. And I think that it is important to note that in community pharmacies in Portugal, we are able to administer all vaccines that are not provided by the National Healthcare Service as within the vaccination coverage plan. So this means that we have a vast number of vaccines that we are able to administer in community pharmacies. And within the flu seasons, already for 2 years, so last year and this year, we cooperated with the Health Ministry to increase coverage of the population by having both health centers and also community pharmacies administering flu vaccines as part of the public health system. So those vaccines are provided to pharmacies by the public NHS, so the National Healthcare System, and are administered in pharmacies. So it's actually a recognition that community pharmacies are ideal locations because of their distribution in the national territory and often more accessible vaccination points than other healthcare facilities such as healthcare centers. Yes, opposition. We have gone against it by providing data on safety aspects, ensuring that pharmacists were ready and there were no incidents occurring in community pharmacies all throughout these years, and by proving that we do have a role in increasing vaccination coverage as well. So this is how we have gathered that support, and we obviously use that support also as feedback on our activity to then improve our communication to the general public, and also to collaborate better with the healthcare institutions. Just as a final point, just to say that nowadays community pharmacists in community pharmacies, when they administer a vaccine, it automatically feeds the national registry, so the e-bulletin, the e-vaccination bulletin for each individual. So we are really part of the integrated network of healthcare providers that are contributing to the vaccination coverage. So fully integrated with the system.
Thank you, Emma. A most fantastic success story, and thank you for sharing your experiences within this field. Inga, what is the situation in Iceland? Is there opposition from other healthcare professionals to the expansion of vaccination providers to include pharmacists? And what is the reason for that opposition? And who is actually supporting or could support pharmacy-based vaccinations in Iceland?
Thanks, Lars, for your question. And thanks, Emma, actually, for your answer, because I think we in Iceland can learn a lot from Portugal. So when the pandemic started here in Iceland, we reached out, as I say, we in the Icelandic Pharmaceutical Society reached out to the Ministry of Health and offered our services in vaccination the nation. But it wasn't until last autumn that we got a reply from our MOH that they actually said that they had checked and there are no regulations or legislations in the country that prevent pharmacists from vaccinating. So all the rules, regulations, everything is in place. At that time point, we started working with the university as well as with the MOH to set up a course for pharmacists to be educated in both how to vaccinate as well as in all adverse event anaphylactic reactions. And it's fun to say today that our first course is actually happening tonight. But when we were trying to set up this course and find someone to teach it, we of course, our first thought was let's reach out to the nurse academy and the university department. There we already met some opposition, both in reluctancy to answer, and then also when they answered, they felt that this was a union issue, and we should reach out to the nurses union to get permission from them to be able to teach the pharmacists how to vaccinate. We did not agree with that, and we are working in close cooperation with our Ministry of Health. So we did find another teacher for us to set up the course. And I think this kind of also comes from being a small independent nations. We kind of tend to, keep what's ours. We are very proud of what we do and we want to do it really well. So we kind of like hold tight to what we feel is ours. But I am sure that in the same way as in Portugal, that nurses will also come around and see that we are there to support them. We are there to support the GP clinics. We will take the load of them and move it to the pharmacy so they can concentrate on something else. So in terms of the support and who could and will support us is, of course, our Ministry of Health is our biggest supporter here. I do believe the physicians will support it as well, because they have seen how much pharmacists can actually support them in all of their work and not just in vaccinations. So we are lucky to have good connections with our Ministry of Health. So we are working with them, but we'll see. And I'm very happy to hear what you did in Portugal to have these surveys done among the public, because as you say, pharmacies are widespread across the country. I think we have record number of pharmacies in Iceland. So why not use them and help relieve some of the load on the GP clinics?
Thank you, Lily. I think it's also interesting how you actually approach those who are responsible for maintaining or creating a sustainable system, because they see the challenges and they know how we need to cope with them. So I think that's also another very interesting example. Dr. Michel, you have been the co-author of a very interesting report called Pharmacy-Based Interventions to Increase Vaccine Uptake, the report of a multidisciplinary stakeholder meeting. What would you say are the conclusions in this report, and what are the key components to increase vaccine uptake by pharmacy-based interventions?
Firstly, I would like to say that I am very pleased to be with you today. We are only two persons who are not pharmacists into this panel, so I'm very pleased of being one of them. I think that I have been interested for years and years about the relationship between pharmacists, healthcare professionals, and MDs. And I'm very pleased to participate because I think that we have a lot of work to do together, and we have also to be very respectful for your work. And I was quite shocked by what said Inga, who had a lot of problems to find teachers and to find collaboration with nurse, school, and university. And this kind of things has not to happen in the near future. We would like to go ahead and to answer your question. I think that one of the most important things to have in mind, I am a geriatrician, is that life course vaccination is very important for the healthy aging. And we have a lot of problem. All of us have a lot of problem, not only to increase vaccination rate in children, which is quite good, but there is a lack of vaccination in adults, and there is a main problem with old adult vaccination. But overall, the most important problem is indeed to convince healthcare professionals, all the healthcare professionals, to get vaccine. And we need to be a team. We need to work in an integrating network, as said by Emma. And I think it is the only way to go ahead and promote vaccination. And I know that I read a few papers concerning what is happening with the help of pharmacists on vaccination. And indeed, the input of pharmacists all over different countries increase the vaccination rate by 5 to 10%, which is excellent, and I have to thank you.
Thank you so very much. Yes, I think you are totally correct that Life course vaccination is a prerequisite for healthy aging, and not only vaccinations for the young children, but throughout the entire life. And of course, collaboration, teamwork, because we are all there to support our patients and consumers. Thank you. John, as a professional affairs advisor of the pharmaceutical group of the European Union, can you describe any examples of best practices from your countries or in the European region in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccinations?
Yes, absolutely. And first of all, thanks also from my side for the invitation. And I'm sending regards and apologies from our president, Roberto Tobia, who was initially planned, but he's not feeling well today, unfortunately. So that's why I'm replacing him. So in relation to indeed interprofessional collaboration on vaccination, I think first of all that we have to point out that obviously in addition to the administration of vaccines, that community pharmacists have a key roles to play also in collaboration with other healthcare professionals in other areas to address and increase vaccination coverage. And that includes the identification of patients, as well as reminding patients, especially in the life course immunization, about their vaccines. That is about advising patients on vaccines and the questions, addressing the questions they have, because of course we know that one of the major challenges and barriers we have today to sufficient vaccine uptake is vaccine hesitancy, which is often fed through online misinformation. And then lastly, pharmacies are in many countries, and also in countries where they do not administer vaccines yet, they are the main point of supply and therefore again for contact and information to the public. So besides it, pharmacists complementing administration of vaccines as a complementary service to other healthcare professionals. In these areas the other areas that I mentioned, we have especially seen very close collaboration between pharmacists and other healthcare professional associations, both at local, regional, national, and also at the European level. And to give you an example on that, we as PGU, we are one of the co-chairs of something what is called the European Coalition for Vaccination, which is a coalition that has been initiated by the European Commission and is a coalition that brings together the different European healthcare professional organizations active in the field of vaccination. And so this will bring together associations from different medical specialties, nursing, dentists, physiotherapists, midwives, and of course also hospital and community pharmacists. And we as PGU, we have been together with the European organization, the Standing Committee for European Doctors and the European Federation of Nurses Association, been the active co-chair leading the work of this group. And this involves indeed also addressing key messages and recommendations to healthcare professionals on how they can indeed collaborate at different levels on vaccination and how a joint effort is so needed to indeed increase that uptake through, again, any of the different areas that I have identified. So that is definitely, I think, a good practice that we can share, and that I think has also raised the profile of the role that pharmacists have in vaccination at European level. And sometimes it starts with collaboration in these other areas to also achieve, let's say, acceptance or successful collaboration then at the level of really the administration of the vaccines.
Thank you so very much, Jan. You're also here quite correct when it comes to answering questions and fight vaccine hesitancy. Just a follow-up questions. Would you say that the work within this coalition is more like solution-oriented and not some sort of preserving different professional roles?
Absolutely, and I think I'll be very honest here, I think probably one of the barriers or one of the reasons why within this coalition we are so good in let's say, or have a very good collaboration among the different healthcare professionals group is we don't touch upon, let's say, the organization of the National Vaccination Service. And I think that's obviously where the sensitivities lie. And that is from a European perspective that we can sort of look over to, because in any case, that is a national competence. And we really focus in this initiative on information provision to patients, to healthcare professionals, and really giving them guidance and advice on how they can work together, but not necessarily recommending what is a role exactly in terms of also the organization of the healthcare system, because that's obviously up to national and sometimes regional authorities to have their the discussions and to have indeed the proper agreements in place.
Yes, thank you so very much. Mariano, from a European perspective, can you describe any examples of best practices from your country in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccination?
Yes, good afternoon. But probably we can start remembering what happens in the first wave of the pandemic, where the most of the doors to access to national health system were closed for non-COVID patients. We remember that citizens, starting from oncological chronic patients, were left almost alone for a while. This was the situation that we have faced the first half of 2020, in which thanks to our survey that we have collected data, the pharmacists represented the open windows to interact with the national health system during this period. Last year, March 2021, in Italy, it was draft signed the first agreement between the region, the government, the region, and the national representative of the pharmacists that allowed pharmacists for the administration of anti-SARS-CoV vaccine pharmacies implementing the law. When I come in the vaccination center or in the when it was the open day for vaccination, I don't ask to anyone, are you a nurse, are you a general practitioner, are you a pharmacist, are you a pediatrician? If I trust in my national health system, I don't ask the one who administrates to me the vaccine. I thank to them, and I think that we have to provide gratitude, eternal gratitude for all the healthcare professionals without any distinction that have worked during the pandemic. Of course, now we need to increase cooperation. And you probably know that we each year produce an annual report of the state of the art of the relationship between pharmacists and citizens in my country, in Italy. There are encouraging data according the involvement of the pharmacists in the vaccination campaign in my country. We have involved 658 pharmacists and 3,000 citizens and patients. Starting from the data of the pharmacists, almost half of the pharmacists involved in our survey have already joined or are joining the vaccination campaign. 87% of the pharmacists interviewed declared themselves in favor, not only to making the anti-COVID vaccination services permanent and also until the end of the pandemic, but also to extend the services to other, as mentioned Jean-Pierre, adult vaccination. And this was also confirmed by 3,000 patients interviewed. 63% are in favor to confirm the vaccination service in the pharmacy behind the current pilot situation, the pilot phase. And 65% of them agree about the opportunity to extend. So you can probably listen a little more the citizens in terms to identify the unmet need of the patient, of the citizens, and then to identify how we can better take in consideration what their unmet needs. In this way, we can probably don't talk about one healthcare professional against another one, but how we can cooperate better. You are mute, Lars.
Lars, you have to get off mute, please.
Sorry.
There you are.
Yes,
worries.
thank you so very much. Yes, you are quite correct, because during the pandemic, there was a lack of access to primary healthcare, and pharmacy remained open and showed how essential they always have been and they are within the healthcare system. And I think you're also right that the increased cooperation is needed. And also, I think you mentioned the importance or actually highlighted the trust our patients, our consumers have in pharmacy. Now I would like to direct myself to Michelle and Emma at the same time. What are the funding models for vaccination provision, and what are the challenges you see within this perspective?
So maybe Emma will start.
Yes, I can start. Thank you, Michael. So in terms of remuneration models in Portugal, what we have is patients paying for the service. What we mostly have is patients paying out of pocket for the service. Patients, when they go to a pharmacy, they have access to the vaccine, which is partly reimbursed, so by the national healthcare system, but then they have to pay for the service which is being delivered. For the flu campaigns in which we have participated in the last couple of years, municipalities have also have decided to support the vaccination service. So they are substituting themselves, substituting individuals in that payment. So municipalities are paying pharmacies for the service that is being provided. In other countries, because you haven't limited the question to Portugal. In Portugal, this is the system that is implemented. In other countries, there are obviously other types of models, namely reimbursement by the national healthcare system, which is something, or private insurers, which is something that we would like to implement as well. In fact, in Portugal, I forgot to mention that we also have this service reimbursed by private insurance companies. So we have a national healthcare system, which is universal and accessible to everyone. But in fact, we have an increasing number of people who also have voluntary complementary health insurance. And some of those plans for health insurance also cover the vaccination service in pharmacies. So these are the models that we currently have.
Thank you, Emma. Michal?
Yes, I will try to shortly describe the situation in Poland, because now we are in the process of change of the funding vaccinations. Historically, in the past, there was two standards of the funding vaccination. It was for the obligatory vaccinations. It was fully paid by the NHS, and it was of course aimed for the child and the teenagers. And all non-obligatory or vaccinations for the adults were paid out of patient pocket. Because of this situation, which I described before, that we've got quite low vaccination rates. In 2018, there was first official document, which was drug policy for 2018 till 2022. So we are just reaching this perspective, which delivered information that some of the vaccinations will start to be reimbursed in the pharmacy reimbursement. And additionally, there was first moment when the pharmacists were mentioned as the vaccinators. Now, when we are during the pandemic situation, the situation absolutely has changed, because the model of the COVID vaccinations is absolutely different than the standard one. These vaccinations are paid by the NHS, both vaccination and service, and the rate is around €13 per shot. Per one shot. Different situation is in regards of flu, because this payment is much lower. But we all know that after the pandemic situation will have to change, and as a pharmacist, we are very interested to provide new model of financing, of funding the vaccinations. When, of course, service will be paid by the NHS, we are interested in this solution, because it will assure that patients will be more interested to be vaccinated at all, but also within the pharmacy. We've got some experience based on the 1,500,000 of doses of COVID vaccination doses delivered by the pharmacists. So we already have some large numbers, maybe not so large like in more experienced countries, but that is for the first year is absolutely enough to propose some solutions. And at the end of the day, of course, we would like to copy paste solution which is for the flu vaccination now and the COVID vaccination for the other vaccinations. Of course, there will be the political decision about the funding, because we have to fit in reimbursement system, which is very complicated and well described. But on the basis of our experiences, we see that there is huge area for the pharmacies to be paid by the NHS. And we also saw that everywhere when this kind of funding is present, it works much, much better. Thank you.
Thank you so very much for your wonderful comments. I think it's also important that we try to convince our healthcare administrations and governments that vaccination is an investment in health. It's not a cost. Not vaccinating will actually increase other healthcare costs for diseases that we will acquire. Now I will hand over to my co-moderator, Ron. I think you have lots of questions as well to our excellent panelists.
Thank you very much, Lars, and great discussion. We could go on for days, never mind another half hour or so. I want to turn to the idea of regulatory frameworks, being a former regulator, and have the question go to you with respect to what regulatory frameworks or enabling strategies have been successfully implemented and developed in your region for the role of pharmacists in vaccination. And keep in mind, COVID is obviously the thing that's brought us together on this occasion, perhaps. But it's one about extending what we've learned and what we're doing under COVID's urgency to develop a framework that becomes a wider vaccination permanency within the region and your specific country. So I'm going to ask Jan to begin the discussion for us, please.
Yes, with pleasure. So let me maybe first start with giving you a bit of a historic overview of how the current regulatory frameworks looks like in Europe in relation to indeed pharmacist delivered vaccination. So as Emma has mentioned already, about 10 to 15 years ago, we have seen the first introduction of a pharmacist delivered vaccination service in Europe. And this was then followed after the example of Portugal by countries such as the United Kingdom, Ireland and Switzerland. And also then after also the introduction, for instance, in a country like Denmark, we have seen mostly since 2018 an enormous, let's say, expansion and almost tripling of that number in a very, very short number of years. We have seen then introductions in countries such as France and Greece, but then as well countries such as Norway. And then during the COVID-19 pandemic, we have seen now the vast amount of countries that have recently been being or have been enabling pharmacists to administer vaccines. Examples of such countries now include, for instance, Germany, Italy, Poland, as of course, as we have heard from Michael, and also we saw, for instance, still today, I received the news that in Luxembourg they have started to administer COVID-19 vaccines in pharmacies. We've heard about Lithuania, and as also Marlene Hams has already specified in the chat, there is also the confirmation in Belgium that pharmacists will be able to administer COVID-19 vaccines, and also from Latvia we have had such a confirmation. So you can hear that within these past, let's say, 3 to 4 years, there's been an enormous expansion of the let's say the regulatory framework at national level. So what do we see in terms of, let's say, again, from a more general perspective on enabling strategies that have successfully been conducted in those countries? I think the first element is, as you all know, is training. I think that where countries have started to train pharmacists even before, let's say, and even before the official negotiations with government on changing any types of legislation, I think that has been a very successful factor to show as an argument from pharmacy organizations, look, our workforce is ready, they are trained, they know how to do it, they know they can do it safely. We have done a lot of investments in it. And it also often shows the high enthusiasm of pharmacists to such a service. And then usually a major barrier that needs to be overcome is indeed acquiring legal rights and to provide vaccinations, often even before certain pilot projects can be done. And that, of course, these legal rights link to certain conditions, such as often to, again, training and, for instance, how the service should be organized. Then two other important elements, I think, that we see, and that where we see also some differences across European countries, is related to indeed something that also been mentioned, is whether pharmacists can supply or administer a vaccine without a prior need for a prescription, because in some countries it's still only possible upon, let's say, the presentation of a prescription from a physician, for instance, that pharmacists would be able to administer vaccines. And so I think that's a barrier that definitely, I think, for a successful uptake, that we really need to have this spontaneous vaccination possible in the pharmacy. And then what has also been mentioned in the question before, and I'll not go back to that, is of course adequate remuneration for the service, so that especially also for patients, this is really something that that is accessible as possible.
So that's great information and a general overview, and the movement within the EU is phenomenal. I'm wondering if I can open it up to all panelists, if they have any thoughts or comments on again, making that regulatory framework that was created with some urgency around COVID. How do we make sure that, it's proven, and I think widely, that pharmacists can do this safely, effectively, with knowledge and training. But how do we sort of take that COVID requirement out of the picture, and maybe, as you've described too, and expand it to the prescribing of it, so the pharmacist can make that decision in the pharmacy with the patient there, more to continue on after COVID has subsided to a greater extent. So I'm going to open it up to the panel. I look forward to having a hand raised and someone commenting in that regard. Well, I guess maybe we've covered everything. Oh, I see Emma. Thank you. You're on mute. Just go ahead, Emma, please.
Yes, so thank you very much. In Portugal, we have a situation where we have been immunizing, so vaccinating since 2008, but we haven't been involved in the COVID-19 vaccination because that had another type of organization, which was actually very effective anyway, because we are quite advanced in terms of vaccine coverage. But now things will change because the big vaccination centers that were set up to vaccinate all the population now are being dismantled. So vaccination is going back to the healthcare centers. So we believe that community pharmacies will eventually be involved in the COVID-19 vaccinations. In terms of the regulatory framework in Portugal, we have started out with only providing vaccines with for people who presented the prescription. But now it has, but now for flu vaccines, for instance, for patients over a certain age and with chronic conditions, we may provide them at the pharmacy without a prescription. And that was a journey that we went through. So what I would say to all countries is that you may start with something, and then you progress into having more vaccines that you can administer. If you start with only one vaccine, you can start with only providing vaccines to those who present a prescription, and then evolve into also being allowed to prescribe or administer a vaccine without a prescription. So that has been the example in Portugal. So I think that that's something that we should all know, that sometimes we don't start out immediately with the full capacity to prescribe and administer, but it's a journey that we can definitely go through.
Thank you very much. And Alain, s'il vous plaît, you have your hand up, please.
Yeah, thank you. Thank you. Perhaps, Ronald, perhaps I can explain, I can say the success story in France for vaccination. First, we start by an experimentation. It's very important because it's a real change. You change. Before in France, only doctors can vaccinate people and nurses, of course, but with a medical prescription. And it's a real change. So it's a very strange. It's a very difficult for health professional and for politicians to change this. So in France, we start with an experimentation in 2 regions. First, for the first years, it was experimentation in 3 years. First years to experiment in 2 regions. We start by 2 regions. The second years in 4 regions. And we can vaccinate like this near 1 million people in 2 years. So health authorities say, it's okay, it works. So we stop the experimentation, and it's because it entered in the law, and now pharmacists can practice flu vaccination. Is the first point. So start with an experimentation. The second point is to win public opinion, if I can say that. When we would like to start to have a flu vaccination, there is a survey, a national survey in a newspaper, in a national newspaper, and we say that around 60% of the French people are allowed, are in favor of flu vaccination by community pharmacists. And now there is a new survey in 2021, and it's now 77% of French people, French citizens, are allowed, are agree to be vaccinated in pharmacists. So what I want to say, when you are in front of a politician, when we are in front of your health ministry, if you arrive and you say, well, yes, we can vaccinate. No, it's not okay, she answer you, but you had to prove this one. So my recommendation is start with an experimentation like this. You can show to the French government and to French people that works in pharmacy. Have quality process, be perfect. In France, we have practical experimentation. We have to have information training, specific training, for vaccination, and we have to show we have this training to practice vaccinations. Have public opinion, as I can say to you, you have the public opinion as in favor of you, so it's easy. So after to present to the politician say, okay, political opinion is for vaccination in pharmacy, so it's okay. And I'm fully agree with Jean-Pierre. We had to speak with the other health professional. We had to speak with doctors. We had to speak with nurses. To explain that we are not against doctors or against nurses, but we are with doctors, with the nurses, to increase the rate of vaccinations. It's difficult at the beginning, but after they can understand and they see the rate increase. So they are very intelligent people. So discuss with these people. Inform doctors when you vaccinate one of his patients, so he knows his patient was vaccinated. So it's very important for this. And I think it's with these 3 or 4 cases, public opinion, quality of your act, experimentation, and like this, we can win to have the right to vaccinate.
Merci, very well stated. Thank you so much. I'd like to just switch our conversation a bit now to the idea of what we recognize as a pandemic, and now moving into an endemic. And I I guess, the plans that you might have in your region or in your mind about how that's going to happen and the role of the pharmacist. And I know I'm going to call on my colleague Mariano. I know there was a position paper on the role of community pharmacy out of the EU, and I'm wondering if some of that might help us learn how we can engage the pharmacists and the pharmacies into that endemic response as opposed to what we're now experiencing through the pandemic. Mariano, would you be able to join in on that?
Yes, thanks. We can probably start from some field that affect all of us, some common field of action, probably starting from the unmet needs of the citizens and the patients, but also the common fight to reduce health inequalities. This, I think that is a crucial point that put together all the intermediate bodies that work in the health issues, recognize health as a common good, all the healthcare professionals. I have some additional data starting from the Italian experience that was a pilot, a case history in a certain sense, because the involvement of the pharmacists on the vaccination campaign was quite new. And we have interacted with 147 vaccination centers in Italy. At the end of this year, the last year, 2021, all the centers were open again in 80% of the cases with the same level of the timetables were restored, while the staffing, the number of experts, the number of people working, only in the 47% of the center were the same before the pandemic. It means that to the citizens and patients, the number of hours in which the vaccination centers are open in terms of experts working there is reduced before the pandemic. Can we imagine that the pharmacists can be supportive on it? Also because only 2% of the vaccination center in Italy are open on Saturday. Because when we talk about complementary, when we talk about a cooperation, we need to be extremely concrete. Also to afford something that affects the citizens when we talk about, and so our role is to qualify as better as possible the relationship between citizens and pharmacists, and to qualify the role of the pharmacist in front of healthcare professional and the institution in general. In Italy, there is the so-called pharmacy of services that is in the middle of the implementation that allowed to the pharmacists to provide a set of services useful for the citizens, useful for the patients, starting in order to increase the therapeutic adherence, for instance, in order to increase the prevention activity in terms of screening and vaccination. So all of these aspects encourage an increased engagement of the pharmacist in the vaccination issues, but probably also the expert. When we have interviewed in Italy 500 among pediatricians and family doctor, the half of them say that it's not easy to convince people, citizens, to be vaccinated. Can we also try to help them to encouraging the fact that if also the specialist can access to the health record of each one in which is written if the patients has been vaccinated or not, can also be encouraged to do it. So we can also invest in some instrument that allowed all the healthcare professionals to encourage the citizens, the patients to be vaccinated, because there is not only the COVID-19, but it's the adult and the so-called routine vaccination that need to be to increase the coverage level. This is true in my context, but it's true also across Europe at least.
Thank you so much, Mariano. Appreciate that. And Inga, I'm going to put you on the spot a little bit on this one. I know there's some challenges you described in Iceland with respect to getting the regulations to support and then in place. But while you're meeting and that challenge, what about the challenge of an endemic response? And Mariano raised an excellent point of one about access. And I think throughout the region, you can safely argue that pharmacies offer that enhanced access to after-hours care, weekend care, not only to address the issue of vaccination, but also maybe in treatment and patient care when you're trying to help meet the needs of the community. Do you have any thoughts on that you'd like to share?
Yeah, I mean, as in moving from the endemic to the from the pandemic to an endemic state, we have closed down our mass vaccination centers, and we have moved the current COVID vaccinations to the GP clinics. But in a response to continuing with the endemic response, so I mean endemic phase, the Ministry of Health actually envisions the vaccinations taking place in the pharmacy for all the reasons you mentioned. I mean, increased opening hours, opening during the weekends, evenings, everything, and easy access as well. What we have there, what we need to improve is the pharmacist needs an access to the central electronic health record system, so they will be able to register that the patient has been vaccinated in their pharmacy. And just a little bit going back on the prescribing rights, that's what we're fighting for as well. So to make this process as smooth as possible, we would need to have the rights to prescribe the vaccine and the rights to register the vaccines in that patient health records. And this is what the Ministry of Health envisions. This is what we envision. And now it's just to work on it to make that process possible.
And those are excellent points. We often get focused on that sharp end of this activity, putting the vaccine in the arm, but there's so much more supportive information, source of truth, if you'd like to use that term, from the pharmacy to educate the public, but also to have that put into their database so that you're collaborating, not only as you speak, you collaborate with your healthcare professionals, but that shared information is obviously a strong form of collaboration. So the next healthcare professional that deals with that patient has a full view of the care that patient's received, regardless of the source. And in this case, we're talking about pharmacy practice. I see we are starting to get towards the end of our time together, and I just want to make certain that we address maybe the public awareness. And Jean-Pierre, I might put you on the spot here a bit, but from your knowledge and experience in the report that you referenced, how do you think we can address the public awareness around things like vaccination, things like vaccination points, the value of vaccination, how it's not necessarily, it does protect you, but it has that greater ability to protect society and your colleagues and your friends and neighbors. How do we get that public education out there to meet the needs of the public?
No, it was, thank you for your question, because it was exactly what I would like to point out. I think that switching from a pandemic era to a endemic era is very important, and the role of pharmacists will be crucial in this way. The first thing that was not mentioned until now, or very low mentioned by Mariano, is the fact that basic education and health and vaccine literacy is very low generally. And there is probably a role of pharmacists increasing the knowledge on vaccine preventable disease of the people in the community and the risk that represent this kind of disease. The second point is that we indeed have to think about the individual protection, but also the community protection. But I would like to go ahead and to think about the environmental protection, because in a pandemic era, we have now the idea of one health, and we have to think about animal medicine and also human medicine. And the role of veterinary are very important. And you are also providing drugs for animals. And I think that this kind of thinking not only of human but one health will be very important to consider. And I think that there is another value linked to this environment is the decrease of antimicrobial resistance. So I think that it is a global aspect that we have to stress on. And to end, I think that something which was mentioned before, but perhaps not enough, is that indeed there is a cost of vaccine, but the public cost of vaccine is not so important, because by decreasing vulnerable and vaccine preventable disease, vaccine is very cost effective and we have to promote it. So I think that the role of pharmacists, by educating, by saying that there is not only one individual protection, but the protection of the community and environment, and to say that it is not costly, I think that it could be a very good argument for convincing, as said Mariano and Alain, all the public around us, but also politicians, to go ahead and have and allow pharmacists to prescribe vaccines.
Merci, Jean-Pierre. I'm going to, looking at as the clock ticks away, I also want to get to the concept and the question about how FIP can assist in creating and enhancing pharmacy-based vaccination program and overall pandemic and endemic responses in your community in the region. But before we open that up to the panel for maybe a brief response, and while you're thinking of those answers, I just want to remind you some of the activities that FIP has already done with regards to support the change for pharmacists, pharmacy access vaccinations. There's FIP publications in there on the website, and they range, they've been working with FIP and the WHO through the Good Pharmacy Practice Guidelines to advocacy tools, global data, guidelines, and practice support tools. One example is the regulatory self-assessment tool for advancing pharmacy services in the area of vaccinations, testing, and prescribing. And I'll ask my colleagues at FIP to put that link in the chat line so people can access that self-assessment tool. FIP organizes digital events and webinars regularly to highlight the different topics related to vaccinations, to share best practices and innovations, and advocate on the role of the pharmacist to improve access to vaccination. The FIP will advocate at the WHO for the role of pharmacy profession and the role it can play to facilitate access and vaccination services and improve vaccination uptake across the life course. And we've talked about that in our panel already. And most certainly through the recently developed Transforming Vaccination Program series, which focused on supporting FIP members and accelerating the programs of equity, not necessarily equality, more importantly, equity, access and sustainability of vaccinations through policy development and legislation implementation. And finally, FIP's work in this area and the resources are available at a dedicated site through prevention.fip.org/vaccination. And again, I'll ask my colleagues at FIP to put those links in the web or in the chat line, please. But I'm going to pause if we have a few moments, just panel members. If there's one or two bullets you can make for the people in attendance of how FIP can support this concept of advanced vaccination access, prescribing, testing in your region. And I see Jan, please.
Yes, very happy to respond, because I think indeed PGU and FIP, we work very closely on this, and we both have indeed missions to indeed, at the one hand, support the national associations with indeed learning from other countries. And I think that's an excellent example of what you have just been presenting that FIP is doing, but also this webinar that you're organizing today. Is informing, is coordinating that exchange between countries, providing a platform for exchanging strategies, but also for evidence. And on the other hand, that is also using those insights from national and regional perspectives to indeed build the case towards also international organizations and institutions, which can also be very supportive with the local and national advocacy work from pharmacy associations on the implementation. And I think there we have seen, and I can share from European level, we have seen the council recommendations on vaccinations. We have seen very promising recommendations from also the EU expert panel on strengthening healthcare systems, but also at the OECD, WHO are crucial institutions which have also been already been supportive of the general principle of indeed broadening access to vaccination through healthcare providers such as pharmacists. So I think they're also closely collaborating also between our associations, indeed ensuring a common messaging and very, let's say, internal support to members is really vital.
Thank you very much, Jan. And Michiel.
Thank you. What I feel, we've got now very special situation to support countries which are not already involved in the pharmacy-based immunization projects. We've got now the hugest project of the vaccinations around the world, and I feel that FIP, but not only that other organizations, may fully deliver evidences based on those vaccinations, which are not most easy to provide, which are complicated, which needs to some more activities to be done. And what I feel now we can provide a lot of data, a lot of support, a lot of evidence for the everyone who still thinks that pharmacies are not ready. We are ready. We are doing that in the millions of dosages, and our experience is that it is absolutely safe. And what FIP may do is just deliver those data.
Thank you for your response. And I have Alain, and then we will move to the questions from the attendees. Alain, s'il vous plaît.
Yes, I fully agree with Michel and with Jan. I think the role of FIP is to create exchange between countries. I remember in 2016, I was in a FIP organization in Buenos Aires in Argentina, and it's at this time we met United Kingdom, we met United States, we made Australia, I think Belgium also, and we can start to imagine to create how to increase vaccination. So the role of FIP role is that this one is, for example, this webinar. But now I hope with the end of the COVID-19 crisis, perhaps we can meet all together. We have a meeting in Sevilla, I think, in September. So I hope we can meet all together in Sevilla, create the exchange, share the experience of the different countries all over the world. I think it's the role of FIP. Thank you.
Thank you so much. And I'm going to go to a quick question what we have written in, and it's one about hesitancy. And from a regular standpoint, the question comes in, from a regular standpoint, are there measures in place in your respective countries for managing healthcare professionals, in this case pharmacists, but not limited to that, who are actively hesitant and are anti-vaxxers and sharing misinformation with their patients? So we're looking for one response, one relatively quick response. This is a big topic. We're going to spend a whole day on that one alone. But if you have any thoughts on how managing anti-vaccine sentiments within the profession or healthcare professions in general, please enlighten us quickly. Well, I see Emma smiling and her hand up. So please, can you answer this within a minute or so?
Yeah, so very quickly, fortunately, well, in Portugal, we have a population that is not very hesitant, and we haven't had cases where pharmacists have been pointed out as part of that movement. We did have a pool of physicians that had an initiative and were, speaking out against COVID vaccine and how it was organized by the Medical Society, which is the regulatory body for physicians in Portugal, which is a self-regulatory system, is that these people were indicated to the disciplinary committee within the Medical Society, and then they had interactions with these physicians, and for some of them, they even suspended their licenses because they were spreading information that was not based on scientific evidence. So we haven't had that situation in pharmacists, but this is what I know based on the medical experience.
Thank you, very, very helpful, and gives us food for thought on how that can be addressed. And some of the activities that are beneficial is preventative, getting to know who these people are and what their concerns are, maybe trying to address those concerns and make that, prevent that interface with the public with perhaps their own biases and misinformation. Now I'd like to turn it over to my co-moderator Lars for some closing thoughts and comments. Thank you very much.
Thank you so very much, Ron. I think it has been a fantastic learning opportunity today to learn from each other. So thank you to FIP also for giving us opportunity to run this most important event today. Pharmacy in public health, I would say, don't miss the opportunities that are being presented to pharmacy now. There are so many opportunities post-COVID, and we need to take this opportunity now. And as I usually say, the train doesn't stop twice. Vaccinations is an extremely important area for pharmacy, for public health, and in creating a sustainable healthcare system. And preventable diseases such as influenza continue to kill too many people each year, not to mention COVID-19. Vaccination rates need to be higher than they are, and people want access to healthcare at the time and in a place that suits them well from a trusted healthcare professional. And pharmacists are the most accessible healthcare professional. And people trust their local pharmacies and their local pharmacists. And to improve vaccine access and uptake, health systems must fully involve pharmacists in their vaccination strategy. We have listened to excellent examples from all over Europe today, and we have learned a lot about the regulatory landscape as well as funding models. We have talked and learned about vaccinations in general, as well as challenges to overcome. And it has been most valuable to listen to our panelists' experiences, as well as that we need to recognize that vaccinations is a pharmacy service. We need to make the environment more supportive, as well as pharmacy itself. So with that, I would like to say that thank you so very much to our distinguished panelists for sharing your experiences today and for your wise advice and providing us with thoughtful and valuable responses. You have indeed educated us today when it comes to enabling multi-professional vaccine prescribing and administration for improved uptake rates. And thank you to you, Ron, for supporting me in this event and guiding us through the event. Great pleasure to work with you. And thank you to GSK Biologicals for your fantastic sponsorship. And thank you, FIP, for organizing the event. And as Ron say, stay tuned at the FIP webpage for new upcoming events. And finally, of course, thank you to the audience. I hope you enjoyed this event as much as I did. And don't forget, the only way to combat darkness is with light. Make it your personal mission to light the candle, and any positive action you can bring or take brings light and dispels some of the darkness. The world now needs all the illumination it can get, and you, my friends, are the sparks that will light our way to a better future. Thank you so very much. Goodbye.
Bye for now.